So I'd like to call the meeting of the Social Services Committee to order. First item of business is approving the previous minutes. Can I have a motion to approve?
Motion.
Second?
Second.
All in favor?
Aye.
All those opposed? Pass unanimous. Item number 1 on the agenda is authorizing the acceptance of grant funding and an agreement with the New York State Office for the Aging regarding the Medicare Improvement for Patients and Providers Act grant to enhance the health insurance information counseling and assistance program. Ms. Stakowitz?
Thank you. So we're looking to go into to apply for funding for the Medicare Improvement Patient Protection Act. It's been around for several years now. It actually is an offshoot of our health insurance counseling and assistance program. The money gets utilized so people can educate about applying for the low-income subsidy program, which reduces prescription costs, as well as the Medicare Savings Program, which allows people to have their Medicare premiums paid for through funding. The funding itself will be distributed to our contractor, which is Senior Services Albany. Some will be maintained in-house for the Department for Aging, and some of it will go to New York Connect as part of the regulation requirement, so the staff there can provide counseling via the telephone.
Thank you. Any questions from the committee? Hearing none, can I get a motion to approve?
Motion.
Second? All in favor?
Aye.
Those opposed? Pass unanimous. Item number 2 on the agenda is amending resolution number 30 of 2017 with Senior Projects of Ravenna for additional funding.
So we had an additional increase in requests for home delivered meals, which is a great thing because we're serving more Albany County older adults over the age of 60. For the Senior Project for Ravenna, we're looking to expand their contract and amend it for 1,070 meals, which comes to a total cost of $8,759 and 29 cents. Sorry.
Thank you. Any questions from the committee?
Yes.
This doesn't have to do with Queemans, but Senior Services just did the St. Vincent's Apartments, and they did a wonderful job introducing the program. Is there anything being done about getting the word out a little more to the community, the aging and disability community?
We've been trying to do that and continuing to increase our outreach efforts. We've been participating in more program efforts and actually going out and doing more presentations with a variety of groups. So you'll see that we'll try to do that a little bit more frequently over the next 6 to 8 months as well. So I think you'll see that the increase that we're seeing in the home delivered meal program, which has been stagnant over the last few years, is starting to grow again. So I think you'll see that will continue to increase.
Is there a reason why these are going through 2 committees, 2 and 3? Last night we had them in elder care. They passed out favorably, and here they are tonight again. Is this going to be something that's going to be a new way of doing things?
It's a good question. Brandon, do you?
Yes, it was in, because it is related to elder care, the decision was made to put it through that committee as well, but it's still under the auspices of social services.
Is elder care now a standing committee?
It is, no, it is not. It is a special committee.
So, in other words, there's no juice in it coming out of elder care and then coming here. Because no matter what we did last night is meaningless unless social services passes it out with a favorable recommendation.
It is in front of the social services committee. You guys can pass it or not at your discretion.
I mean, I guess my point is, are we going to be coming here every month and doing one night and coming back and doing it again on such a minute item? Somebody's giving us money and we're talking about this thing for 2 nights and tying up people for 2 nights coming downtown. I mean, if it goes through elder care, that's fine. If it comes through here, that's fine. But I don't think we need 2 committees to make these things happen, especially such a minute item where the money's on the table and what we're doing is saying okay to money.
Is this the first time an issue has come before 2 committees?
No.
Not a non-standing committee. This is a, social services is a standing committee, elder care is not a standing committee. They have come before 2 committees before, but they were both standing committees.
I think going forward, we'll look at, see what makes sense going forward. For now, it should definitely
no,
be
I
in social
understand
services
that.
committee, but we'll evaluate and see exactly what committees items like this in the future should go through. Thank you. Any other questions? Okay, no other questions, so can I get a motion to approve?
Make a motion.
Second. All in favor? All opposed? Pass unanimous. Item number 3 on the agenda, amending resolution number 33 for 2017 with Peter Young Industries for additional funding. Ms. Stadwick?
It's the same concept as the senior project for Ravina. Peter Young Industries we need to do a contract amendment. We've actually served 1,953 additional meals that were unanticipated. So the contract amendment award we're looking to do is $14,647.50. It's the same as senior projects, a 75% state, federal share, 25% county.
Thank you. Any questions from the committee? Ms. Lockhart?
Can I just, I'm not on elder care, but was this in front of elder care too?
Yes, it
So
was.
all these are
Yes, all-
vulnerable? Okay. No, I just wanted to,
Okay, thank you.
trying to figure out what's that.
Any other questions?
Good question.
I'll make a motion.
Motion to approve, motion to second?
Second.
All in favor?
Aye.
Those opposed? Pass unanimous. Thank you, Ms. Sakowitz. Item number 4 on the agenda, authorizing an agreement with Children's Health Home of Upstate New York regarding Medicaid reimbursement. Ms. Commissioner Geo Hagan?
Gahagan?
Sorry.
No problem.
Hagan. Apologize for that.
No problem. Deputy Commissioner Maura Manning is actually going to present that item, if you don't mind.
Okay, don't mind at all.
Thank you so much. The department is looking for authorization to enter into a contract with the Department of Health for health homes. We currently are going to have designated the health home of Children of Upstate New York, and it's called Chunny. And basically, the health home started in 2017 and took over for the Office of Mental Health, would reimburse us for Medicaid to provide intensive case management and supportive case management services for children. Now it's called Care Management. This transition was part of the Medicaid redesign team and actually impacted adult case management services about 4.5 years ago. So they really wanted the adult side to get up and running before they turned it over for children. So last year was our first year in starting Care Management, and we'll continue, we hope, with our contract with Chunny.
Thank you. Any questions from the committee? Hearing none, can I get a motion to approve?
Motion.
So Mr. Clay, motion to approve, seconded.
Second.
All in favor?
Aye.
All opposed? Passed unanimously. Item number 5, authorizing an interdepartmental agreement with the Albany County Sheriff's Office regarding a part-time law enforcement coordinator for the Children's Advocacy Center. Commissioner?
Yes, thank you. So at last month's Social Services Committee, we presented a request for the Children's Advocacy Center, which is our comprehensive system of response to reports of serious child abuse and sexual abuse, and we have since received a resolution on that. As part of the grant funding, we also have added the component of a law enforcement liaison, and the concept behind that is in order to be more effective in our coordinated approach, it seemed to be in the best interest to have someone from the law enforcement community to facilitate that communication and to really be able to enhance having the law enforcement community as a part of our team. And so last year, Bethlehem PD actually facilitated that role, and as we move into this year's contract, we're requesting to have the sheriffs facilitate that role. They have agreed to, with approval, that that is a role that they're willing to have in this year's contract.
Thank you.
I have a question. So I live in Bethlehem. I think a lot of the Bethlehem police, was this done sort of as a test just in Bethlehem, or were they doing this throughout the county?
No, it actually, whoever is in that role of the law enforcement liaison actually is for the entire county. So they're representing the law enforcement community. And when we established this role, it was on the basis that it would rotate. We thought that would be a fair and equitable way, if you will, to have an opportunity that all law enforcement agencies could facilitate that role. And so it just so happened that last year, Bethlehem came forward and said that they wanted to facilitate that role. And so as we go into this next year, the sheriffs have indicated their willingness to participate in that role.
Was there going to be a continuation of the, kind of the cycling through different law enforcement?
Exactly. So once this year's contract is completed, we would then send out again a request to all law enforcement agencies, as we did this year. This is how the sheriffs were the ones that have expressed that they were willing to do that. We send out that request to all law enforcement agencies, and they have the opportunity to accept or to decline.
Okay, all right, thank you.
Thank you. Ms. Lockhart.
Just for clarification for the committee, all the law enforcement agencies in the county all participate strongly with the Child Advocate Center. That coordinator just helps to coordinate some of the meetings and stuff, but everybody's on that multidisciplinary team, and it's worked beautifully in investigations over the years.
Thank you, Patty, yes.
Okay, so what you're saying is that Bethlehem and now the county is just kind of a coordinating role, but actually all of the law enforcement are
Because they all bring their
Yeah,
cases
okay,
to the
okay,
CAC.
Thank that.
But that law enforcement's a piece.
Thank you. That
Yes, I
helps.
apologize
Helps me
for
understand.
It's not just one guy out there.
Any other questions from the committee?
I'll make a motion.
Motion to approve? Second?
Yep.
All in favor?
Aye.
All opposed? Pass unanimously.
Thank you.
Thank you, Commissioner
Can
Hagan.
I don't mean to
Sure.
pull Commissioner's horn here. Commissioner, Maura?
Oh, I'm sorry.
I just want to say for people that don't know, Albany County was the lead in New York State and parts of the country in handling child sexual abuse when nobody else was. Maura and I, back in the early 80s, and numbers of other people, but
Yes,
it's a model. You guys should be really, really proud of it. Albany
we are,
County should
and
be
it
very,
is
very proud of
very
what they've done.
effective and doesn't traumatize the children any
Saves
further.
A lot of children been treated.
Thank you.
Thank you.
Thank you.
Okay, item number 6, authorizing an agreement with the Schenectady County Community College regarding certified nursing assistant training at the Albany County Nursing Home. Mr. Slatky?
Thank you. This is an agreement with Albany County Nursing Homes, Schenectady County Community College to allow their students who are prospective, anticipated to be CNAs, to get their training at the nursing home. The instruction will be done by their staff. We will only be utilized as a training site. There's no money being exchanged by either parties. This should be an ongoing agreement, if we're permitted to do so, with a 30-day out clause, with the understanding that if there is going to be a 30-day out clause implemented, that it would be at the end of any training session by the college.
Thank you. Any questions from the committee?
The trainees, will they be doing a on-the-job training? And then will they be taking the place of the job that was supposed to be?
They will not be taking the place of. They will be working along with. They can't take the place of a certified nursing assistant at the nursing home. They will just be doing on-site training in concert with our staff under the supervision of Schenectady College instructors.
So this will help you with your staffing level?
Well, we hope that when the CNAs graduate, or when the students graduate and become CNAs, that we will be able to recruit them. We've already been doing this with BOCES, and it's been somewhat effective, and now we're expanding to Schenectady County Community College.
So this is like a co-op program, but we don't have to pay for it.
Correct.
I like that.
Any other questions from the committee? Yeah, all in favor?
Aye.
Sorry, motion to approve?
So moved.
Second?
Second.
All in favor?
Aye.
All opposed? Pass unanimously.
Okay, thank you.
Thank you. Okay. Item number 7, amending resolution number 309 for 2017, extending an agreement with SUNY Center of Human Services Research. Mr. McLaughlin?
Thank you, Mr. Chairman. This is just a basic contract change. The previous authorization, I'll be as diplomatic as I can. The finalization of our contract with SUNY took a little bit longer than we had hoped. So we are simply shifting the time frame out a little further. We've already begun working with them. There's no change from a cost perspective or anything like that. We just, because the resolution specified the month to month that the contract would last, we won't be able to hit the time frame. So we're asking just that we shift that period of time a couple months, and then we'll complete the work as usual.
Okay, thank you. And any questions from the committee? I'm going to ask a question. I know a while back we received I think it was a preliminary report from this Human Services Research study. I'm wondering at what stage is it at, and what was that preliminary report, and what will this, once the report is complete, what will?
That was a survey of our departments that informed this stage of the process. That report kind of set a baseline for where our departments are, contact issue, with an equity agenda. So this is the strategic planning phase of that effort. So now that we know where our departments are, this is really the education phase. We're sitting down with our departments, figuring out what areas can improve, whether it's internal to the departments or out with how they interact with the community, and then the implementation of those efforts to make sure that we're maximizing equity within the county and all of our functions. So that was the precursor to this phase.
Okay, thank you.
I'll make a motion.
Okay, motion to approve, seconded. All in favor?
Aye.
Opposed? Unanimous, passed unanimous. So, can I have a motion to adjourn? Motion. Second. All in favor?
Aye.
Okay, thank you.